One of the things I do at MYOH is direct the Hereditary Cancer Risk Assessment Program. So we see patients who are both established patients of NYOH and those who are not, who are maybe referred to us by another provider, to assess the likelihood of a genetic syndrome in the family contributing to cancer risk. So typically we would see people who have certain features about either their diagnosis themselves or about their family history that are suggestive of a familial syndrome. Those can include things like particularly young age at the time of a cancer diagnosis, multiple cancers in the same individual, or multiple cancers in a family that are all the same type or the same types that fit with a specific syndrome. Seeing cancers on both sides of the body in paired organs, so breast cancer in both breasts or ovarian cancer in both ovaries, kidney cancer in both kidneys. So seeing in paired organs that you've got cancer on each side can be kind of a risk. So what we do when we see patients is take a pretty extensive history, it takes a bit of time, about them and their family members, and then we sort of take all that together along with their ancestry and assess what is their risk of having a certain type of familial cancer syndrome. And then we may or may not recommend genetic testing based on that information. Sometimes we can fortunately review it and reassure people, hey, this doesn't really look like a familial cancer syndrome. Good news, and we don't have to do the testing for you. But if we see something that looks suspicious, then we can go on and do that testing. We always provide follow-up counseling to our patients, and long-term, if somebody's at increased risk for a syndrome, we can continue to monitor them over time and help with their cancer surveillance or getting them set up with preventive procedures.